Hello everyone, welcome to Patho Excellence. In this microscopic description to diagnosis series, today we are going to explore a fascinating yet clinically significant parasitic disease, Hydatid Cyst, also known as Echinococcosis. This condition continues to be an important public health problem in many parts of the world, particularly in regions where livestock rearing is common. So, by definition, these are the tapeworm called cystoid infection widespread across the world. Common cause of hepatic cyst, and it is caused by the larval form of Echinococcus tapeworm, mainly Echinococcus granulosus. It is the most common and causes cystic disease. Second is Echinococcus multilocularis, less common and causes alveolar disease. Echinococcus vogeli, that is polycystic disease, and Echinococcus oligarchus, that is extremely rare and unicystic form. So this is the picture of adult worm, which is having correlates and strobila. Correlates is having sucker, then neck portion, immature segment, mature segment, and this is gravid proglotid. It is around 2 to 7 millimeter long. This is the section view of adult worm, and this is the larval form which contains hooklets and suckers, and there is an egg which is 30 to 36 micrometer long and having 3 pairs of hooks. This Echinococcus main method of harming the host comes from the cyst formed by the larval form and not by this pathogen itself. This cyst, if developed enough, will swell and put pressure on the surrounding tissue and causing blood vessel obstruction as well as necrosis of the surrounding tissue. And additionally, upon rupture of this cyst can cause allergic reaction and possible anaphylactic shock if the fluid from the cyst spreads via the bloodstream to other parts of the body. So here, let's see Echinococcus granulosus, also called as hydatid worm or dog tapeworm's life cycle. Now, the definitive host is the dog, where the adult tapeworm lives in the small intestine and releases eggs in the feces. These eggs contaminate soil, water or food and are accidentally ingested by intermediate hosts like sheep, goats, cattle and sometimes humans. Inside the intestine of intermediate hosts, the eggs hatch into oncospheres, penetrate the intestinal wall and enter the bloodstream. They most commonly lodge in the liver and lungs, developing into the characteristic hydatid cyst with germinal layers and brood capsule filled with the scolices. When dogs consume infected organs of livestock, the cycle completes as the scolices develop into the adult form in the dog intestine. Now, humans are an accidental dead end host, meaning the cycle cannot continue through years, and patient is infected with this larval form and ultimately develop hydatid disease. So most commonly affected organ in human is liver, brain, lung and other sites. Frequently communicate with biliary tract and rare in breast but should be considered in the differential diagnosis of breast mass in endemic region. So, macroscopically, if we see this cyst is spherical up to 30 centimeter or more in diameter and has a fibrous ring. So, this is fibrous tissue already cut open, and it frequently contains several daughter cysts. So, these are the small clear fluid containing daughter cysts. Microscopically or histologic description shows it having cyst wall which has three structural components. Outer acellular laminated membrane, second germinal membrane which is transparent nucleated lining, protoscolices attached to the membrane and budding from it. Protoscolices are ovoid and contain hooklets. They are birefrigerant under polarized light and a sucker, and the outermost fibrotic layer with granulation tissue with increased eosinophils also present. So, this is the diagrammatic picture of this hydatid cyst. The outer layer, it is called pericyst. So, pericyst is host tissue adventitial layer. Middle one, that is laminated layer, which is acellular and barrier against host immunological response. And inner one, that is germinal layer, which produces several biologic elements of the this metacystoid. It contains cystic fluid, brood capsules, and protoscolates. And these are called daughter cysts. Daughter cysts, here we can see protoscolates, which is nothing but the budding of this germinal membrane of the brood capsule of the hydatid cyst. Here this is exocystic brood capsule, and it become embedded in the laminae of the laminated layer and progressively be pushed outside. So here this is the microscopic picture of this cyst wall. Here this is the laminated germinal layer. This is the key feature for diagnosis. Outer one is fibrous layer, and here germinal layer is containing the brood capsule and it contains protoscolices. Let's see Echi slide section. This is outer one is pericyst layer. This is the laminated layer which is proteinaceous in nature, and this is germinal layer. And inner one is germinal layer which form a capsule and which is called brood capsule. So this is the cyst, laminated layer, germinal layer. This is brood capsule containing multiple protoscolices. These are the protoscolices which contains sucker. So this is the high power view of this protoscolices containing bilateral suckers and central hooklets. This is a wet mount microscopy which contains plenty of hooklets which are acid-fast positive on gel Nelson stain and stain with GMX. This is stain slide containing many hooklets and laminated membrane. So, ultrasound and CT MRI are helpful for diagnosis. In ultrasound, we can see unilocular cyst with daughter cyst. So, it will have a cyst within cyst appearance. Floating membranes, water lily sign. In CT MRI, there is calcified cyst wall or multivesicular appearance. And diagnosis is mainly by imaging and serology, which includes ELISA and Western blotting of this hydatid cyst fluid, and some molecular techniques like polymerase chain reaction, which is RT-PCR and MLX qPCR. Genotyping nowadays available is POX1 and ND1 by PCR and ITS1 region. Postmortem diagnosis is possible with the in the liver and lung if cysts are present. And emerging techniques are nanotechnology, which is nano biosensors using gold and silver. So this is how hydatid cyst is diagnosed, and it is very important to diagnose a hydatid cyst because it can cause many symptoms, and it is highly infectious, so it must be treated. And fine needle aspiration is avoided because leakage of this fluid leads to risk of anaphylaxis. So if you like this video, then please like, share and subscribe this channel for more such cases. Thank you. Stay tuned.